Aseptic techniques for infection control: clean, disinfect, sterile. Training objectives: introduction to and general knowledge of the methods and levels of aseptic technique decontamination. Cleaning: definition, general recommendations and procedures. Disinfection: definition, general recommendations and procedures. Sterilization: definition, general recommendations and procedures. Overview: asepsis is the absence of pathogenic organisms, e.g., bacteria, viruses, in a medical or health-related setting. Aseptic technique is any process or procedure utilized to reduce number of contaminants or prevent transfer of microorganisms, with the goal of maximizing and maintaining asepsis. 4 types. Clean uses basic routine cleaning techniques. Disinfect uses medical techniques. Surgical uses sterile techniques. Barriers, containment, e.g., surgical attire, medical device bagging, to prevent controlled spread of contaminants. Antiseptics are antimicrobial substances capable of preventing infection by inhibiting growth of microorganisms. Overview: decontamination risk level. Types of hand hygiene: clean, routine. Purpose: cleansing before and after patient contact. Risk level: low. Products, agents: warm water and use of non-antimicrobial soap. Residual effect: short. Types of hand hygiene: disinfect, medical. Purpose: hand antisepsis or to remove antimicrobial resistant pathogens to harmless level. Risk level: intermediate. Products, agents: use of aseptic products, e.g., alcohol, sanitizing foam, sanitizing gel, or lotion soap. Residual effect: can be sustained depending on product or agent. Types of hand hygiene: sterile. Purpose: process that kills or removes all microorganisms, including resistant spores. Risk level: high. Products, agents: surgical scrub iodophores, betadine, chlorhexidine gluconate. Residual effect: can be prolonged depending on agent. Overview. Summary. Although it's impossible to keep your hands germ-free, washing your hands frequently is the first line of defense against SARS, foodborne illnesses, the common cold, the flu, and other infectious diseases. Elimination of infection is the goal of asepsis. In all medical settings, hand-washing techniques are an important step in asepsis. Overview. Summary. If you have questions about high-level disinfectants, sterilants, or how to clean, disinfect, or sterilize a particular medical device, first contact the manufacturer of the product. If you are unable to obtain sufficient information in this manner, contact the Food and Drug Administration, FDA, Regional Office, or the FDA Center for Devices and Radiological Health at 301-443-4690. Clean technique. Definition. Clean technique is also known as routine hand washing. Removal of dirt, organic material, and transient microorganisms with plain soap and water or an alcohol-based hand sanitizer, a cleanser that doesn't require water. Hand drying and or use of non-sterile gloves. Preferably done before disinfecting hand wash if the hands are visibly contaminated. Essential step before a sterile scrub. Clean technique. Routine hand washing. Indications. Hands are visibly dirty, contaminated, or soiled, or after eating, blowing nose, coughing, sneezing, touching garbage, using toilet, or touching any waste product. Before putting on and taking off gloves. Before providing non-invasive procedures, e.g., taking blood pressures, feeding patients, etc. Before providing invasive procedures. Clean technique. Routine hand washing. Indications continued. Before having contact with patient's skin and or mucous membranes, body fluids, excretions, etc., or other body parts. Before leaving patient's room. Or after touching, with bare hand or gloved hand, any object that may be contaminated by blood, saliva, or fluids, i.e., wound dressings, medical devices. Clean technique. Routine hand washing. Procedure. Routine hand washing techniques for most clinical settings involve a series of steps. 1. Remove jewelry prior to hand washing. 2. Avoid clothing contact with sink. 3. Wet hands with running warm water. 4. Dispense generous amount of approved soap cleanser into palm. 5. Wash each hand for a minimum of 15 seconds, creating vigorous friction. 6. Scrub the backs of each hand between fingers, cleaning under the fingernails and washing wrist area. Clean technique. Routine hand washing. Procedure continued. Routine hand washing techniques. 7. Rinse both hands under running warm water, removing soap residue. 8. Allow water to flow down forearms, keeping hands lower than elbows. 9. Dry hands using disposable towel for each hand. 10. Use towel to turn off faucet. Do not touch faucet with bare hands. Tip. Short, less than quarter-inch, natural, unpolished fingernails will allow for a more thorough cleaning. Disinfection technique. Definition. Antisepsis hand washing is the use of water and antimicrobial soap detergents containing agents that will reduce concentrations of resident flora and inactivate transient microorganisms from hands before glove use. Disinfecting agents include iodine, chloroxylenol, chlorhexidine, etc., antiseptic hand rub, alcohol-based hand rub waterless antiseptic agent containing 60 to 95% ethanol or isopropanol. Disinfection technique. Hand washing. Indications. Before, putting on gloves for short invasive procedures. Put gloves on according to sterile gloving guidelines, shown in later slide. Procedures that include suctioning, placing an IV or urinary catheter, medications. Patient care of those at high risk of infection, e.g., HIV/AIDS patients. Contact with other parts of patient's body, leaving patient's room. Disinfection technique, hand washing. Tip. The duration of aseptic hand washing is important, not only for mechanical action to be effective, but also to allow antimicrobial products sufficient time to be effective. Minimal time required for disinfecting hand wash before rinsing is 2 minutes, or according to manufacturer's instructions. Disinfection technique, hand washing. Procedure. Doing it the right way. 1. Remove jewelry prior to hand washing. 2. Avoid clothing contact with sink. 3. Wet hands with running warm water. 4. Dispense approved antiseptic cleanser into your palm. 5. Wash each hand for minimum of 1 minute, creating vigorous friction. 6. Scrub the backs of each hand between fingers, cleaning under the fingernails and washing wrist area. 7. Rinse both hands under running warm water, removing soap residue. Disinfection technique, hand washing. Procedure continued. Doing it the right way. 8. Allow water to flow down forearms, keeping hands lower than elbows. 9. Dry hands using disposable towel for each hand. 10. Use towel to turn off faucet. Do not touch faucet with bare hands. If using antiseptic hand rub, 1. Apply product to palm in manufacturer's recommended amount. 2. Rub hands together, covering all surfaces of hands, fingers, and wrist area until dry. Sterile technique, hand washing. Definition. A sterile scrub is an antiseptic hand wash or hand rub performed prior to surgery in preparation for surgery by a participating healthcare provider in a sterile area. Requires use of long-acting, powerful antimicrobial soap or agent on the hands and forearms. Requires using soap or agent for longer period of time than used for typical hand washing. Requires hands dried with sterile towels. Requires sterile gown, sterile mask, sterile gloves, sterile supplies. Sterile technique, hand washing. Indications. Before putting on sterile gloves, surgery and other invasive procedures, placing of thoracic lines, central lines, etc. Sterile technique, hand washing. Procedure. The CDC recommends at least 2 to 5 minutes of scrubbing. Thorough drying is essential, as moist surfaces invite the presence of pathogens. Contact with a faucet or other potential contaminants should be avoided. The faucet should be turned off with a dry paper towel or, in many cases, through the use of a foot pedal. Despite this careful scrub, bare hands are always considered potential sources of infection. Sterile technique, gloving guidelines. Sterile gloving guidelines, CDC hand hygiene recommendations. Putting on sterile gloves requires a specific technique so that the outer glove is not touched by the hand. It is essential in both open gloving and closed gloving, putting on gloves with a sterile gown, that the sterile gloves do not become contaminated. Procedure. Open gloving. Inspect the glove package for signs of contamination. Discard if you find any of the following: water spots or moisture, tears, any other evidence of damage or contamination. Sterile technique, gloving guidelines, procedure, open gloving continued. Open the sterile package. 1. Place the package on a flat, clean, dry surface in the area where the gloves are to be worn. 2. Peel the outer wrapper open to completely expose the inner package. Position the inner package. Remove the inner package, touching only the folded side of the wrapper. 2. Position the package so that the cuff end is nearest to you. Unfold the inner package. Open the package to a fully flat position without touching the gloves. Expose both gloves. 1. Grasp the lower inside corners or designated areas of package. 2. Pull gently to the side without touching the gloves. Sterile technique, gloving guidelines. Procedure, open gloving continued. Put on the first glove. 1. Grasp the cuff at the folded edge and remove it from the wrapper with one hand. 2. Step away from the table or tray. 3. Keeping the hands above the waist, insert the fingers of the other hand into the glove. 4. Pull the glove on, touching only the exposed inner surface of the glove. Note, if there is difficulty in getting the fingers fully fitted into the glove fingers, make the adjustments after both gloves are on. Sterile technique, gloving guidelines. Procedure, open gloving continued. Put on the second glove. 1. Insert the fingertips of the gloved hand under the edge of the folded over cuff. Note, the gloved thumb may be kept up and away from the cuff area, or may be inserted under the edge of the folded over cuff with the fingertips. 2. Keeping the hands above the waist, insert the fingers of the ungloved hand into the glove. 3. Pull the glove on. 4. Do not contaminate either glove. Sterile technique, gloving guidelines. Procedure, open gloving continued. Adjust the gloves to fit properly. 1. Grasp and pick up the glove surfaces on the individual fingers to adjust them. 2. Pick up the palm surfaces and work the fingers and hands into the gloves. 3. Interlock the gloved fingers and work the gloved hands until the gloves are firmly on the fingers. Note, if contamination occurs during either procedure, both gloves must be discarded and gloves must be added. Sterile technique, gloving guidelines. Procedure, closed gloving. Putting on gloves with a sterile gown. 1. As hands will be covered with gown sleeves, a team member must open the inner package of sterile gloves. 2. With non-dominant hand inside gown cuff, pick up glove by grasping folded cuff. 3. Extend dominant forearm with palm up and place palm of glove against palm of dominant hand. Glove fingers will point towards elbow. 4. Grasp back of glove cuff with non-dominant hand and turn glove cuff over end of dominant hand and gown cuff. 5. Grasp top of glove and underlying gown sleeve with covered non-dominant hand. Sterile technique, gloving guidelines. Procedure, closed gloving continued. Putting on gloves with a sterile gown. 7. Carefully extend fingers into glove, ensuring glove's cuff covers gown's cuff. 8. Glove non-dominant hand in same manner. Use gloved right hand to pull on the glove. Keep hand inside sleeve. Note, if contamination occurs during either procedure, both gown and gloves must be discarded and new gown and gloves must be put on. Sterile technique, gloving guidelines. Procedure, closed gloving continued. Removal of gloves. 1. Grasp one glove at the heel of the hand with the other gloved hand. 2. Peel off glove, retaining it in the palm of the gloved hand. 3. Reach under the cuff of the remaining glove with 1 or 2 fingers of the ungloved hand. 4. Peel off the glove over the glove being held in the palm. 5. Do not contaminate self. 6. Discard the gloves according to local standard operating procedure. 7. Perform a decontamination hand wash. Note, when removing gloves after a procedure is finished, the gloves are removed after the gown is removed, inside out, using glove to glove, then skin to skin technique. Medical devices. Medical asepsis prior to inspection, service, repair, or transportation. Equipment that has been in contact with patients or their body fluids may transmit infection to those required to service, repair, or transport it. must be adequately decontaminated according to manufacturer's guidelines, or must be placed in a leak-proof rigid container that has a secure lid or placed in a tear-proof bag. Whenever possible, should be thoroughly cleaned and decontaminated before each reuse. Must be bagged again when transporting it into facility. Accidental contamination. Avoid contaminating yourself or others. Wear sterile gloves to protect yourself from patient's pathogens while protecting patient from environmental pathogens. Dispose of equipment and secretions properly. Accidental penetrating injuries are an occupational hazard. Put all equipment and specimens in moisture-proof containers for transportation. Be careful not to contaminate yourself or the outside of the container. Follow facility policies for disposal of or cleaning contaminated surfaces and materials. Lesson summary. The goal: reduce healthcare-associated infections. Infections occur when staff spread microbes to patients or from patient to staff. Germs move to patients from hands and from objects used for patient care. Prepare in advance for the type of hand hygiene that is necessary. The use of clean, disinfection, or sterile techniques reduces the number of germs transferred and thus reduces the risk of infection and disease.